The honourable member for Calgary-Edgemont has a question.
It's Women's Health Week here in Alberta, and women make 50.1% of that population. Yet research funding for women's health represents a shocking inadequate 3.4% of overall health research dollars. This government continues to dismiss women's experience in the health system by chronically underfunding targeted research, clear data, insufficient reporting, and policies disconnected from women's lived health realities here in Alberta. To the Minister of Status of Women, how can this government justify allocating such a minimal amount of research funding on issues that are impacting half of Albertans in women's health?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I'm happy to respond to that question on women's health issues and in terms of the research. In fact, Mr. Speaker, the members opposite, when they were in government, provided zero for women's research. We, on the other hand, doubled our initial commitment of $10 million to $20 million over 2 years, Mr. Speaker. That is a commitment to make sure that women's issues are being addressed, that they're being looked at because they are unique, and we deserve that, Mr. Speaker.
The honourable member for Calgary-Edgemont.
Given the majority of Alberta's frontline workers, educators and caregivers are women, and given knowing their economic security depends on our championing better health outcomes for women, given that health delays are sidelining women from the workforce, and given that women's full participation in the economy is critical for Alberta's economic future with preventable health barriers forcing women out of their jobs, when will the Minister of Jobs, Economy and Trade take action to ensure women's health is treated as an essential component of building and sustaining Alberta's economy?
The Honourable Minister of Arts, Culture and the Status of Women.
Thank you, Mr. Speaker. Mr. Speaker, it's incredible what our government does to support women in the workplace, whether it's the scholarships we have, from the Persons Case Scholarship to the STEM Scholarship to our recently announced Women in Applied Arts Scholarship that help women in underrepresented fields, to the amazing work that multiple ministries do to supporting organizations like Elevate Aviation, Women Building Futures, and other organizations that get women into underrepresented jobs and support their economic security. This government continues to support women and will continue to do so in the future.
The honourable member.
Given that was a terrible spin when I was asking about health and not STEM, and given that Alberta's continue to pay out of pocket for birth control that's provided free in other provinces, given that universal access to prescription contraception is a basic health care right, and we know that access saves healthcare dollars, reduces unplanned pregnancies, and helps people plan for their futures. And given that the federal government has stepped up and introduced a national pharmacare plan that includes contraceptive coverage, again, to the Minister of Jobs, Trade and Economy, what is this government doing to fight the federal government? No, sorry. Why is the government fighting the federal government about the economy but refuses to...
The Honourable Minister of Health.
Thank you, Mr. Speaker. And of course, Albertans, and particularly women who are Albertans, can rest assured that we are continuing to provide access to reproductive care products in the province. We continue to work with the federal government on the pharmacare, but I have to tell you, Mr. Speaker, it's very disappointing to see that the federal government, of the $1.5 billion that they promised to pharmacare, that they've already allocated roughly about $1 billion of that to just 3 provinces, Mr. Speaker. And so, Mr. Speaker, those provinces, how are we going to adequately get that funding when they haven't promised enough?